Welcome, welcome everyone. Thank you for joining Catholic Health Australia's Hope at the Margins webinar series. Today's topic is Health Starts with Home. We have more than 70 people registered for today's webinar, and thank you all for taking the time to join us today. I'm really looking forward to today's discussion, and I hope that you find this conversation as insightful as the conversations that I've had with our panelists in the lead up to today. Firstly, can I start by acknowledging the traditional owners of the lands on which we are all meeting today? I'm Adrian Kerr, Director of Communications at Catholic Health Australia, and I'm joining you from the Eora Nation, and I pay my respects to the Gadigal people and their elders past and present who have been custodians of this land for generations. For 25 years, I've lived in Sydney in King's Cross, an area well known for rough sleeping and those living on the margins of society. And today I'm coming to you from an office just up the road from the Matthew Talbot Hostel, which is a well-known shelter and support service for homeless men run by the St Vincent de Paul Society that's been operating since 1938. We hope that today's webinar not only shines a light on the extent of homelessness, but that we hear in our conversations today some great stories about how our own services can be beacons of hope. As we embrace the Jubilee year, Catholic Health Australia's Hope at the Margins webinar series highlights how the work of Catholic services can bring hope, especially to those who are navigating challenging and at sometimes desperate circumstances. It's a chance for us all to reflect on the transformative power of hope and to celebrate the unwavering commitment of our sector to those most in need. Today's webinar on homelessness is a topic close to our hearts and sadly a growing crisis that leaves countless individuals and families vulnerable, disconnected, and without the basic security of a home and its relationship to health and aged care. With the recent passing of Pope Francis, our discussion seems all the more significant today. As a Pope of Mercy, he referred to people experiencing homelessness as the nobles of the street. And we know that they were very close to his heart and to his papacy. As Catholic services focused on the whole person, we are called to be a source of hope, offering not just care, but dignity, compassion, and pathways to a better future. Our discussion over the next hour will explore the current landscape of homelessness, the challenges faced by frontline services, and the ways in which our ministries can continue to respond with courage, innovation, and unwavering faith to uphold the dignity of every person. Now, we are very fortunate to have an amazing panel with us today, experts who are working at the coalface of homelessness services. I won't read their extensive biographies as you have those already, but it is now my great pleasure to introduce to you Sandy McKiernan, Director of Homelessness and Support Services at St John of God Healthcare, Brett Macklin, Strategy Delivery for Homelessness and Housing at St Vincent de Paul, New South Wales, and Erin Longbottom, Nurse Unit Manager at St Vincent's Homeless Health. Thank you all for joining me today. If I could start by setting the scene and getting a sense of the reality of homelessness, and I'd like to hear from all of you here. Starting with you, Sandy, what is homelessness, and do we need to challenge our own definitions and beliefs about the issue?
Thanks, Adrian, and hi, everyone. It's great to be here. Yes and yes. Yes, we definitely need to challenge what homelessness is. I suppose I work in St John of God Healthcare and direct what we call social outreach. And so for me, my services are all homelessness. So that encompasses youth homelessness services in WA and Victoria, and an adult homeless services that is a primary focus in mental health in New South Wales and Sydney. I think stereotypically we think about homelessness as the people that are visible, those that are rough sleeping, those obviously unfortunately the face of homelessness, if you like, from both a media perspective, from a community perspective. But the reality is that there are only about 6% of people who are experiencing homelessness if you look at the data. The last census in 2021 really helped us sort of see a little bit more clearly that the majority of homelessness are people in what we would think secondary homelessness, which is basically people who don't actually have a permanent home. They might move from shelter to shelter. Couch surfing for young people is very significant there. Short stays of a few nights here, a few nights there, maybe some respite in a hostel for a while. And then tertiary homelessness, which is more that longer term old style boarding house with no self-contained space. There's a lot of shared bathrooms if there are multiple people, and often there's no name on a lease. So people who are houseless as one part of homelessness, but often experiencing homelessness is not just not having a home, it's not having a sense of security, it's no stability or privacy or safety, and you have no control over what your living requirements look like. So for our clients, then add on different cohorts. So for our young people, they're often in very precarious home situations. Family domestic violence is a big driver of young people into homelessness. But for many young people, they don't actually identify as homeless for a long time because they're staying with a mate or maybe an extended family member for a period of time. So it takes an experience of rough sleeping for those, out in the streets for them to often identify that. So from a data point of view, homelessness is on the rise. Census after census, we're collecting more information. Specialist homelessness services will definitely be able to sort of identify that there is an enormous unmet need across the country, that we are certainly seeing significant shifts in people who are experiencing homelessness. COVID was a really big game changer in terms of people who for once might have actually had the funds required through JobKeeper when we saw people have a living wage. But equally, it was a really difficult time for those people who were sleeping rough or in precarious home housing when a lot of services were not able to stay open. So we certainly have seen shifts and changes, and I hope going on today's theme is that our shifting communities' understanding of homelessness. I think that's been a big part of what we've been doing for quite some time. Statistically, there were over 122,000 people experiencing homelessness in the 2021 census, and 1 in 7 of those are children under the age of 12. So we are affecting young people, children, mothers, older women as a growing cohort, over 55s who find themselves without homes after divorce or bereavement. There's certainly a lot of data that's suggesting that we've got some significant shifts in that group. 1 in 5 people experiencing homelessness identify as Aboriginal or Torres Strait Islander. So we certainly see some significant cohorts in our already disadvantaged populations experiencing homelessness maybe for the first time. So definitely a need for us to shift and change how we do things.
Great. Thank you for kicking that off, Sandy. Brett, how about you? Do we need to challenge our own definitions or beliefs about homelessness?
Thanks, Adrian, and thanks, Sandy, for starting off with all the stats. I guess for me, definitely, going on what Sandy has said, the traditional view of someone who's homeless is someone who's rough sleeping, typically an older male, maybe with an alcohol problem, and they only make up a very small proportion, 6 or 7% of the actual population that are homeless. I think our view needs to change, but also the view of what is homelessness. It's not just a bricks and mortar response, but it's also a dislocation or a disconnection from community, from the control of what a stable home environment provides. What we're seeing now is, so I work for St Vincent de Paul, and we are one of the largest providers of homeless services within New South Wales. We cover everything from across the continuum of homelessness support, from rough sleeping, supporting people in crisis accommodation to long-term tenancy support in social and affordable housing complexes. So we get to see the entire gamut. What we're seeing now is like the new face of homelessness are our neighbours, potentially our colleagues and workers. If you're a frontline worker trying to live near where your service is, you're going to be paying really high rents. So we're seeing our potential homeless workers at the risk of homelessness themselves. In our regional services, the typical homeless person applying or seeking support are families where you have parents working. We're seeing this like the only response, literally, if there's no temporary accommodation or no rentals, working families with kids going to school, we can only offer a tent. So with that comes a whole further loss of dignity, the loss of control of your family routine. So we definitely need to change the view of homelessness from who is actually homeless, who we are seeing as homeless, and also homelessness being just a single issue. There's many different issues that actually bring someone to being homeless: mental health, drug and alcohol or addiction issues, trauma, release from custody or release from some other type of institutional setting. And so people are entering homelessness, exiting those services and entering homelessness. It's multi-layered. So I think gone are the days where it's just here's a house and then you're no longer homeless. You also need the support to keep people housed. People escaping domestic family violence becoming one of the biggest increases of homelessness. Women over the age of 55 with limited means are suddenly finding themselves homeless after renting for like 20, 25 years. And these are very everyday occurrences we're getting in our services. So definitely need to change the view of what we would consider homeless, but also the response, as in his bricks and mortar response. It needs to be a whole of system response, but also support from the health sector or probation and parole, mental health, all of that to wrap the support around to keep people housed as well.
Right. Thank you very much, Brett. Erin, from your perspective, what is homelessness? Do you have anything else to add?
Gosh, that was a very comprehensive response from my fellow panelists. I think all those things were extremely accurate and very, very well said. I think probably one of the things I would like to just hone in on a little bit is some of that census data, which was really interesting, spoken about by Sandy, which was that the last census in 2021, there was an increase of almost 6,000 people, and 80% of those people were women. And I think that the really interesting thing that I am seeing at the moment, and heartbreaking thing I'm seeing at the moment, is a lot of older people who are sleeping rough, who are not probably what we would think about as somebody who's the traditional rough sleeper, as it were, and Brett kind of went into what we see as that stereotypical person, but as people, a lot of older women and older men who have just fallen through every gap in the system. So every system that's designed in our society to support someone, keep them safe, has failed that person, and they've fallen through all the gaps, and they often end up sleeping on trains, sleeping in parks, trying to find some kind of way to keep themselves safe, but may not have their capacity to actually get out of that situation. The other
and these are new people who are presenting to services. How do they present?
We find them, and this is what I mean. So I do quite regular street patrols with my team, and we find people sleeping in train stations often. We found an older woman sleeping in a pretty significant train station in Sydney some time ago. And it's often people whose house has become unlivable, or all their families passed away and they don't have the capacity to live independently, so they've struggled to navigate that situation. Or, you know, there's a lot of complex reasons that people end up in those type of situations. So it can be really challenging for that person to exit that, even when they've got support, because some of those situations can be really complex. I think too, the other thing probably that we are seeing, and I'm hearing this anecdotally as well, is people and families and women sleeping in cars. So particularly families sleeping in cars, and they're often missed because they're not visible. And that's a really, really big challenge for us working. You know, we obviously look for people sleeping rough. So the work that I do at St Vincent's is we do patrols on pretty much every day, sometimes more than once a day, where we go out and meet people where they sleep on the street. But if you're sleeping in a car, that's often you have to move, it's not visible, you might not know that person's there, so it can be quite challenging to engage with that cohort of people. So it really depends on them seeking help rather than you taking help to them, which often is taking help to someone obviously cuts through a lot of barriers. So yeah, and I think one of the other things when I was thinking about your question too, Adrian, is that one of the biggest misconceptions about homelessness is that people who are homeless are scary or different than us. And I think what I take from what Sandy and Brett has said, yes, there's people that have really tricky situations and challenging situations in their life, but actually we're not that different. I think a lot of it is thinking about our common humanity, and that, yes, that person's in a really difficult situation, but they're not different than us. Not really. They just have had something difficult happen to them, and it's often thinking about what's happened to that person rather than that, their differences.
So just picking up on that, is it true that there is a stereotype that people who are homeless ordinarily might have a mental health issue or a substance issue? I'm hearing from you all that it's a broader problem and there are new cohorts of homelessness coming through. Is that a fair assumption?
I think there is some truth in that, and I think there's just different cohorts of people, because I do think we can't overlook that mental health is a really significant driver of homelessness, and we don't have an adequate response to it yet in society, I don't think. And I think there's people who have a mental health issue are often significantly disadvantaged, and when I say a mental health issue, I'm talking about often a psychotic illness, so like a profound mental health issue, but also people with a history of trauma. But I do think even whatever the person is, whether they have a substance use issue or a mental health issue, we often have common wants and desires and strengths and amazing things about ourselves that is overlooked because you're often seen in a certain way. And I think it's just trying to look beyond that as well.
Do other members of the panel have anything further to say about the misconceptions of homelessness, if you like, and what you're experiencing?
Further to what Erin has said, not just being homeless, being losing the loss of control, the loss of or connection to family and community, there's certain stresses there. So there's also the risk of developing or having some level of depression or anxiety, some type of stress that comes through from being homeless. So if there's no underlying mental health concern leading to being homeless, there's also that really high chance that once you are homeless of developing a certain diagnosis, whether it be situational or ongoing, but definitely being exposed, feeling that vulnerability, loss of control, just not knowing where your children are going to sleep that night, or are you going to be safe? could lead to further trauma, which could activate some level of mental health concern. So even if someone may not have anything diagnosed, the prospect of being on the streets or in a dangerous or vulnerable situation, that trauma can also lead to further mental health concerns.
I think that's the World Health Organization definition, isn't it? It's, mental health leads to homelessness and homelessness leads to mental health issues. So it's often like a bit of a chicken and egg situation.
Yeah.
And I think we have seen and have evidence is when you provide someone with a safe home with the right supports, that a lot of that can be resolved, and people will normalise back to other, if there is an underlying sort of persistent mental health issue in a supported, controlled manner, and they live and work and do all the things that lots of people in our community do, but that loss of housing can escalate, and that loss of housing also predisposes people to lose connection with family, with medical practitioners, with even maintaining medication. There's so much there that then precipitates and makes their mental health diagnosis worsens and escalates. So we see it in our Casa Venegas service when we provide that space and safety. All those things we can work with and manage with the right community supports.
So just before we touch on the role of Catholic services, we are in a cost of living crisis. We are days away from an election which is being fought on the very issue. Can I ask you all, how do you think the housing crisis and the cost of living pressures, and indeed other economic factors, are contributing to a growing number of people experiencing homelessness at the moment?
I think for our services, and I would expect this happening everywhere, is that we are what we call transitional, that we're not a forever home, because we sort of see ourselves as being able to help more people. And in the past, moving people to priority housing through, Department of Communities or whatever that looks like in your state, it certainly is not easy, but it was easier. So the people are not moving anywhere. So the availability of new housing means that we just have this blockage in the system, and so we are extending people's time with us fairly routinely because of the lack of affordable housing. So these are people who are on disability pensions for the majority, or we even have some young people on sort of youth allowance or home start, with those benefits are very small, and so finding private rental with those levels of incomes is impossible. In WA, Anglicare run an annual housing sort of review. At the last one, which was, I think it was September last year, there was 0 houses that were affordable for young people who are living on a youth allowance, none. So they're forced into shared housing, which has its own precariousness in lots of ways, but then add in some of these challenges. So I think the cost of living is hitting everybody, but when we're starting to sort of see people who are having to choose, in particular families, which my colleagues here are dealing with, are choosing rent over food, we're seeing that flow-on impact is happening to, we're seeing more and more children experiencing homelessness, and certainly for our young people, they're precarious in their financial situation anyway. They don't have any control over that. I think it's definitely having a major impact.
Brett?
I agree. As mentioned earlier, we're seeing people, like families that parents are working and there's no availability of affordable accommodation in areas. So the only option is, if they want to stay in that area where their kids go to school, where they work, are either areas like caravan parks or tents, but sleeping in cars. And as you remove one certain type of cheap accommodation, that pushes people that traditionally that was a safety zone for, then that becomes even unaffordable for the clients that are traditionally using those safety zones to, like that safety net, to find accommodation. It may not have been perfect or what we would consider long-term, but it did meet a certain need for a certain client. Now that's not available as well. And I just touch upon when a homeless service is also providing support to our frontline workers because they're at risk of homelessness, you can tell that there's an impact, affordability, cost of living. We have common stories of, will I pay rent or will I buy food? And I think you're seeing the corresponding rise in the use of food pantries or other donations to families are paying their rent or mortgage, but are needing other charities to survive. And so going to food pantries or community kitchens just so that they've got food on the table. And that's not taking into account if you've got medication or any other supports that you may need. So again, it's a spiral.
Yeah. And Erin, cost of living pressures.
Well, I'm going to bring it back to our rough sleeping population, which I know very well because that's what we often work with, the cohort we work with the most. So there's been research done in Sydney that basically that has said that every person that's sleeping rough pretty much is living below the poverty line. So if you're already existing in a situation of financial hardship, and to be honest, a lot of the time we meet people that have no income at all, how are you going to afford a house? How are you going to see a GP when you have to pay a bulk billing? There's very little bulk billing appointments, and you have to pay a gap fee. How are you going to afford those medical tests? How are you going to afford medication? So it's incredibly difficult at the moment, increasingly difficult for people to afford those things, to be able to see a GP, which means that we're seeing an increase in people in the emergency department, we're seeing an increase of people at our clinics, and we are seeing an increase in chronic disease and other avoidable illnesses, to be honest. So I think the other thing I would say is we're also seeing an increase in people who are working and sleeping rough. So we're finding people in car parks and on the street that have their Uber Eats delivery bikes with them, and that just can't get into the rental market and can't afford accommodation and are really struggling just to make ends meet.
So is there a role there for government in social and affordable housing?
That is the biggest driver of homelessness, is we do not have enough houses for the amount of people in Australia.
What about divorce rates? We've had a couple of comments from people watching us at the moment. Are you seeing an increase in divorce rates that are having that impact on women and children, even men, being homeless?
I don't think divorce is an issue that we see. The issue is family and domestic violence. So if you look at the Human Rights Commission, it says the two main driving factors of homelessness in Australia right now are the lack of social and affordable housing and domestic and family violence. And so it's not divorce, it's actually women needing to leave violence often and not having appropriate places to go, or not being able to have the support that they need. And it's a national crisis, actually.
All right, listen, we've painted a very comprehensive picture of the reality of homelessness, and it's been an amazing discussion and certainly taken my understanding to a new level. I want to now focus on how we can bring hope into dark places. Can I ask you all, what role do you think that Catholic health and social services play in responding to homelessness? Is it unique?
Where I was reflecting on this question, Adrian, I actually think nearly every homelessness service I know is an NGO. and often coming from, whether that's a religious or a community base. And so I think the uniqueness is that homelessness services are predominantly provided by agencies that want to work in this space, see people as people, not people as numbers or widgets or those sorts of things. And so I'm relatively new to St John of God, but have worked in other Catholic organisations. And I think a very mission-driven and values-driven organisations, which I think all of us are here for. You attract like for like people who believe in a better society, who want to sort of see shifts and changes in our communities, are the sorts of people that come and work in our organisations. If you don't align with the values of the organisations, it's probably not the right place for you. And I've, for a long time now, seen the work that I need to do, my purpose and drive, is related to those values and principles, which I think we see very strongly in Catholic healthcare and Catholic organisations. I previously worked for Vinnie's a while back, and I think that connection into parishes and congregations where people are living and breathing in their communities and working to support each other is really powerful. And the sense, I think the challenges that come with government sort of outsourcing to agencies like ours is the funding challenges of all NGOs, where that in and of itself brings the challenges for us. It's not the values, it's not the mission, it's actually we have unmet need in every one of our services. I'm sure many of those watching will agree, is there's never enough money to provide the wraparound supports. And we see consistently government, they've just done it again with national funding for housing infrastructure. There's $1 billion on the table, but there's no money for service delivery. And that consistently over my 35 plus years in the sector is the biggest challenge. It's not who's providing, is that it's piecemeal. It's, yes, we absolutely need to develop houses, but we cannot provide homelessness services without quality staff, highly trained. We're over-regulated and all those things that are really important in keeping people safe. But to me, that's probably our difference, is that we do it anyway, and we find ways to do it from a funding point of view.
And Brett and Erin, do we make a difference?
I would say definitely. And I think Sandy touched upon it. It's that certain inherent dignity of the individual or the families we're working with. They're just not a number walking through the door. If they present as homeless, then we just don't go, here's a house for you. It really is, what else do you need? What led to being homeless? What can we supply? Do you need assistance or a referral or connection to mental health, ongoing health? Do you need any number of any type of assistance? And if we can't do that ourselves, then we look quite assertively to make sure that client is through no wrong door or requires the support they need. And I think a lot of the time we do rely on our fellow Catholic social services who have the same level of thinking that we do to make sure that client is supported. And they may come to us for a certain need, but we ensure that wraparound support, and it's through sourcing through our fellow Catholic social agencies, we're able to provide that support. There seems to be this ability to really close collaboration, looking outside the box to support that client.
Erin, do you have anything to add? You're on mute, sorry.
I'm sorry. You think I would be used to that after 5 years? Was that the role of Catholic Health and Social Services?
That's right. Yes. Yeah.
So I think the service that I work for at St Vincent's in Sydney is the only multidisciplinary health service actually just dedicated to working with people experiencing homelessness in New South Wales. So it's a huge service. It's an outreach service. There's a lot of different parts to it. We have residential care and as part of the service as well, and outreach care and drug health, mental health, oral health, Aboriginal health, peer support. So lots of different parts to it. And I don't think that that would be even in existence if it wasn't for the hospital that I work for and the work of the Sisters of Charity. So I think the legacy that they left, that they still have on the work that we do, means that there's this sort of understanding that we can work at the margins, that we can push the boundaries, these stories run through everything we do, the history, the mission, and their vision. I think just means that we can do more than your average local health district, if that makes any sense. So a service like this wouldn't typically does not exist within a local health district. And so I think this is the uniqueness of the health service that we find ourselves in the work of the sisters that runs through what we do.
And
Look,
building
I think
on
it's
that,
a really, sorry,
I
Brett.
think building on that, I think that it's a generosity of our long-term patrons, supporters, and benefactors. They allow us to go outside of the funding envelope. They allow us to provide extra service provision, extra flexibility when the funding envelope may be very limited, but the ongoing support that we get from the parishes and the Catholic community means that we really can strive or think outside the box, trial new evidence-based practice. Whereas if you're a government organisation or your local neighbourhood community centre, as an example, you are limited. So definitely our benefactors and patrons and supporters who are generous in spirit and funding allow us to do that.
It's a great segue into my next question, which is about innovation and where you see hope in this space. Are you able to sort of tell us about a program or some sort of partnership that you might have that you feel is really outside the box or making a difference on the ground?
I think for St John's, and I echo my colleagues here, in the heritage of our organisations is really powerful. And we have the Sisters of St John of God who came to Australia in the late 1800s. And I think they just firstly hoped that they'd get here safely. But they set the scene for, I think, working in spaces where other people don't. And for us, I think about innovation, our Horizon House program, we have 2 houses dedicated to young parents. So, which is another area of growing concern of young individuals and actually even other mothers or parents who are managing children. So our Horizon House Young Parents House, young people between the ages of 16 and 24 who are either pregnant or with their child under 2. And in and of itself, it's a safe place. But a lot of what we're doing in this service, we have other young people in every other house, but specifically in our parenting, we are working on how to build our young person primarily into the best parent they can be. And the focus is on the young person, not the child. We make sure the child's safe and all those sorts of things, but child development, we bring in those services. But for us, really sort of focusing on the development of people who, often young people who've not had great parenting experiences themselves, who's might have not had active parenting, or they might have experienced domestic and family violence or absent parents. We certainly have quite a lot of those. But also what's, I think, really important, that we've done some great work around cultural competency, that we have a lot of Aboriginal young parents where parenting is a very different approach. And so ensuring that our caregivers, which are our staff, we call them all caregivers, are really engaged in understanding that kinship and kinfolk for Aboriginal people in particular is really an important component. It's not just this is how you raise a child in the context of culture. I think that's really important. So yeah, I'd really love to highlight our young parents. We'll be opening a new service here in WA in the coming months, which is the first new Horizon House for a long time, where we're going to provide another 6 independent units for young parents and their children with wraparound support and communal support. I think for us, there's an opportunity there for us to grow our connection to our hospitals and our relationships with our antenatal and prenatal care. We're looking forward to doing that. But yeah, I think in WA, we don't have very many services that look after that cohort.
That's great work, Sandy. Thank you. Brett and Erin, innovation.
I think innovation just happens. I'm really trying to think of an innovative program, but I see that we see a need, and then the service delivery morphs to meet that need. It could be doing outreach. We've got Vinnie's vans that work closely with other, like with Erin's team. There was a need there to engage. Like I think, yeah, when I think of innovation, it just happens on the ground where you see this need. How can we adapt to support that need or to support that community? How do we pivot into, okay, this isn't working, or we're seeing an increase in this type of client need? What resourcing do we have, and how can we meet that need? I think it just morphs. I really don't think, for us anyway, we don't have the time to sit back and go, how are we going to be innovative? You really are seeing what this need is. And then while you're doing it, then you've got the opportunity to go back and maybe do an evaluation or try to write it up. But it really is on a frontline provision, depending on, say, domestic family violence, rough sleepers, whatever it is, you really are, okay, what resourcing do we gather? How do we morph that support? This isn't working. We're seeing it. There's a need in a certain community or a certain client cohort. We're not making any traction there. How do we do that? What partnerships do we have? I think being agile and flexible and working with similar like-minded values-based organizations also help you with that.
Yeah, Erin.
As Brett touched on, I think one of the coolest things that we've been doing recently, which I think has been a really innovative response, is the work we've been doing with Vinnie's vans. So I think the interesting thing is we actually chose Vinnie's vans to partner with because of the incredible amount of work that they do. So they're different than, so there's obviously a lot of mobile voluntary services in Sydney, but Vinnie's vans provide some different types of care. They provide more than just food. So if you have Vinnie's vans turn up, they have gift cards that they can give people emergency support, funding, housing support. They can link people into different services. They can provide social connection. And so there's like a lot of different bits and pieces that they can do. So what we have started doing is we've been setting up hubs in the inner city where people can come and access support from a different range of services. And that's not a new concept in itself in terms of innovation. But one of the other issues we experience in the inner city is we have a lot of different health services working with people experiencing homelessness. And part of the problem that we see is that means that our clients get care from a lot of different services. And that means that often their care is quite disconnected because they just do what they can do to get their needs met, as it were. So if they need to go and see a doctor, they'll just go wherever they can. And that's not necessarily the best kind of care, because what you want is a consistent GP that knows what's going on with your care, that can provide good follow-up and referral and coordinate your care appropriately. So what we've tried to do is actually think about ways that we can work around this issue. And we've been trying to bring in the local health districts and some of the other health services to go, let's all sit in the same area, let's complement what we do, and make sure that we're working together. And those touch points where we can come together. So we might, in Sydney, we have Southeastern Sydney Local Health District, we have Sydney Local Health District and us, and we now have a big hub once a week where we can come, we all communicate, and just improves our communication dramatically, and people can come and they can access services for a range of different things. And Vinnie's vans also come. They provide housing support, they provide food, and that's just led to these incredible partnerships where it's just made us all stronger together. And we also have consumers that access those hubs volunteering and helping serve and also receiving connection there, because I think part of the problem that we're also experiencing is social isolation, which I think Sandy and Brett have talked about as well is people not having access to social support, and just increasing spaces for social inclusion, I think, is also really important.
So are these people who are on the verge of homelessness, or they've already become homeless and they're socially isolated?
No, actually. So we have people that are still rough sleeping that help us. And we have people who have been rough sleeping and now are in boarding houses that we've worked with, or that we've supported through different levels of their journey as well. So we do have lots of different, just whoever you are, you're welcome. But I think we do come back to social isolation as being a key issue that sits within our society at many different levels, not just for people experiencing homelessness, but often contributes to somebody remaining homeless, I think.
So in the time we've got left, looking ahead, what policy and systemic changes would you like to see that would make your jobs a whole lot easier?
I mean, obviously more housing, greater access to housing and the support, but also greater coordination between the different sectors. As mentioned, homelessness itself isn't just a single issue. What led to someone being homeless, what supports could have been put in, a focus on early intervention and the resourcing to work on early intervention to keep someone housed. When someone becomes homeless, then it's even harder to get them rehoused, or the ability to access affordable accommodation. They lose all that connectedness to either health or community. So a real focus on early intervention, funding to do that. But as a homeless provider, also, I guess, access to those supports that are specialist supports that are needed, such as the mental health, addiction specialists, counselling, trauma counselling, support for children to minimise the impact of being homeless. So it's, just greater integration and accessibility for the homeless clients or those at risk to make sure that they're supported.
Andy and Erin?
I think you very well covered, Brett. One of the things I see in alarmingly increasing rates is the inability for our young people to access mental health diagnoses, in particular around ADHD, autism. They're underdiagnosed in this cohort, generally because either family disruption or the availability and the cost of these things is really high if you can get to see someone. So our current national legislation you need to have psychiatry review. There's been a really big push for some of that to be released back to a less high cost and less bringing not necessarily to a GP but to a psychologist. We see that as a major barrier. So for young people who not necessarily don't need the label, but they need the support that might come with that. So being able to access NDIS, for example, if you've got a psychosocial disability, you can't get it without a diagnosis. So we have an enormous amount of young people who are have very limited supports because of the lack of that connection to that diagnosis. And if you move outside of a city, the regional wait times are enormous if they have the specialist to do it anyway. So that's an area that I think is an increasing need for our federal and state governments to be looking at how do we service that need. And it's not just for young people experiencing homelessness. In general, that's really hard, but it's out of reach completely for our cohort.
I think that's such a key issue, Sandy, because when we talk about ending homelessness, we talk about something called turning off the tap, and early intervention is part of that. And where do you start early? It's with young people. And so I think looking at youth homelessness and putting resourcing into that and figuring out why young people become homeless and what's driving that, as well as putting, changing some of those accessibility issues, I think is key. And then obviously, like we've talked about this the whole way through, is we need more social housing. And our homelessness services need to be better funded. I don't know about the other states as much, but I do know that in New South Wales, homelessness services are drastically underfunded, and the government is not giving us any additional resourcing to actually provide more homelessness services as homelessness is growing. So we're having a real issue at the moment where we're going into homeless recommissioning for our services, and where the funding hasn't increased in however many years, and the services haven't been able to increase in however many years, and we've got homelessness skyrocketing. So we're looking at in the last street count, so in the city of Sydney where we live, the council do an annual street count where they go around, they have volunteers that go around and count people sleeping rough on the streets every year. And in the last 12 months, it's gone up by 80 people, which is quite a significant amount because it's been stable since COVID, sort of sitting only going up about 10 people, and all of a sudden there's been a big jump in the last 12 months. So we're looking at, an increase in homelessness, but we're not seeing corresponding funding. So yeah, that's definitely a need.
Yeah. Okay, look, we're running pretty close to time. I think we could go on, but I just want to recap on a couple of valuable insights that I've picked up. One would be understanding that the definition of homelessness is much broader than I first thought. So thank you for that. I think also a key takeaway has been that without the not-for-profit sector, many, many more people would fall through the gaps. Yeah. And it sounds like the work that you're doing and our other member organizations are doing, it sounds that to me that we are in some ways leaders in the field. I guess that's to Brett's point about being more agile and being able to respond to the need as you see it on the coalface. And I think that's like such an important insight. Is there just one final brief comment from each of you? Obviously, we are thinking about hope on the margins. Is there hope on the margins? Sandy, Brett, Erin?
Oh, there
Yeah,
has to be.
absolutely. Yeah. Sorry, Brett. I think when I was reading through some of our work, hopeful people, when we can instill hope in young people and in our older people, it just promotes healthy behaviours. They start to want to seek and have better lives. So we need to keep hope alive for all these, all of our clients and consumers, because there is a sliver of hope even when things seem desperate, and I think we have seen that through in all areas of our work in healthcare. Hope is a driver for people. It gives purpose. It can help rebuild communities when there's been devastation, with natural disasters and those things. So, and people are very resilient, and I think that's probably one of my takeaways is the people that we meet are incredibly resilient, and you show them compassion and a glimmer of a way forward, and on the whole, where they can, they'll grab hold of that, and that's hope, that they know that things could be different. And we may go up and down, and that trajectory is never in one line, but there's definitely a way forward for everyone.
Great point. Brett and Erin?
I can only echo that from Sandy. Again, acknowledging people's resilience. Sometimes the frustration comes from trying to navigate the system or being knocked back so many times. So as a worker, a frontline worker, our role there is to keep that hope going, keep telling them that something didn't happen today, but there's an appointment tomorrow, or let's go for another viewing next week or this weekend. Part of our role is to keep that hope, not just for our workers. It's quite dismal coming in and that turnaways and capacity is limited, but the hope that we are moving people through, we are stabilizing our clients, and people are being housed. It may not happen overnight, but there's that real hope of a better future for our clients.
I think I have hope in us. I feel like we, in a world that's becoming increasingly divisive, where, we're looking at people, focusing on fear and trying to, be quite polarizing. If we can get past that, I see hope. And I feel like that what we need is really about, I talked about it before, as social inclusion and opportunities for that, where you can speak to that person who you think is different than you, where you can find things that you have in common rather than focusing on your differences, and practicing tolerance and inclusion. I think that's where the hope lies. And I think there's just so many good people in the world that want to do that and actually want to make the world better. And we see that every day. I know Brett and I see that every day because we work with incredible people, and they give us hope. They give me hope.
Wow, that's an amazing sentiment to end our webinar on. So thank you all, particularly Sandy, Brett, and Erin, for all your generous time and insights on the topic. To everyone that's joined us today on the webinar, thank you for your time, and we hope that you got a lot of information and a broader understanding of the issue from our fantastic panel. So thank you once again, Erin, Sandy, and Brett. And to everyone else, we hope to see you for another CHA webinar very soon. And of course, thanks also to CHA's Director of Mission, Bridget Meany, for coordinating today's webinar. Thank you, everyone.